Assalamu alaikum. My name is Hina and today the topic of my discussion is persistent corpus luteum. The case presentation is that the case is presented in the species hybrid 9-year-old Afrikaner cow. In the history, we came to know that it served 2 years earlier, but there will be no return to estrus, and the farmer assumed it is pregnant. And the presenting complaint is that failure to calve despite prolonged presumed pregnancy. Because the farmer assumed that animal is pregnant, but it is not. And general condition of the animal is it is over condition, good body condition score, BCS level up to 5, and the animal was brought for reproductive tract assessment prior to culling. Farmer decided to cull the animal. So the history is last bred 2 years early, did not show any behavior estrus afterwards, and farmer assumed prolonged pregnancy. Good previous reproductive performance as she gave 5 calves, and now it is brought for reproductive tract assessment prior to culling. The physical examination when are done by physical examination was done by two veterinarians. Cow appeared healthy but little bit overweight. The and physical examination was done by rectal palpation and rectal findings by veterinarian 1. He observed hard cystic-like structures on the right ovary, 10 to 25 centimeter, and the rectal findings that are done by veterinarian 2. He observed Duffy distended uterus, enlarged right ovary, and hard twig-like structure felt in the cervical lumen. And as the rectal exam results are conflicting because it will not clear the that what is the case, so recommended later for definite diagnosis. As the postmortem findings came to know that her right ovary enlarged 5 centimeter with large persistent corpus luteum occupying 75%, and both ovaries had small cysts. Pyometra also seen because there will be 200 ml thick yellowish brown pus. So, cervical lumen filled with inspissated crystalline mucus plug, and findings confirm that persistent corpus luteum secondary to pyometra. As we observed in the diagram 1, when the right ovary are incised through the center showing a yellowish corpus luteum occupying more than 75% of the ovary. And in the second diagram, pus coming out of the incision of left uterine horn. It can be the differential diagnosis of persistent CL is cystic ovarian disease, pyometra, pseudopregnancy, early pregnancy loss with retained CL, mucometra, uterine adhesions or fluid accumulation, and chronic endometritis. Treatment treatment is only applicable if diagnosed ante-mortem. So we done the treatment with PGF2 alpha therapy. Single dose is usually effective for luteolysis, and the brands that are available in Pakistan are Lutalase, Asterplan, and Astromate. GnRH followed by PGF2 alpha 48 to 56 hours later, and treat the concurrent uterine infection with intrauterine or systemic antibiotic. Spotty therapy also done by answers to therapy if needed. But in this case, treatment was not attempted and one was cured. Outcomes are that postmortem confirmed that there was persistent corpus luteum, pyometra, cervical mucus plug, condition explained 2 years, and estrus and cow slaughtered. So conclusion is that there will be persistent corpus luteum, and uterine infections are major contributor to the retained CL. Early diagnostic to rectal exam, ultrasound, progesterone assay, and PGF-12 remains the treatment of choice if identified timely, and case emphasizes need for regular productive monitoring and early intervention before occurring. Thank you so much. Allah.